Good evening, everyone. Thanks a lot for staying with CNN News 18. I'm Shivani Gupta. You're watching News 360. Now, angry reactions have been pouring in across the national capital and, in fact, the entire country after it came to light late last evening that a special, exclusive 100-bed COVID facility is being set up only for High Court judges, the judicial officers of the Delhi High Court and their families. What we were being told is that the Delhi government is converting as many as 100 rooms of the 5-star Ashoka Hotel in the national capital as a special, exclusive, elite COVID facility for the High Court judges, families and judicial officers. Now, this of course raised many eyebrows because this is happening at a time when the common public cannot find beds, leave aside ICU beds or oxygen beds in the national capital. Now, earlier it was being projected that this is being done at the behest of the Delhi High Court or on a request of the Delhi High Court itself. But what has come to light is even more damning for the Delhi government led by the Aam Aadmi Party. In fact, it is their own order which stated or suggested that they are doing this because of a request of the Delhi High Court. I want to read and I quote what their order stated. And whereas a request has been received from Delhi High Court for setting up of CHC facility for the Honorable Justices and other judicial officers of Delhi High Court and their families. But the High Court has now clarified that no such request was made by the judges themselves. In fact, the court has come down very heavily on the Delhi High Court just under an hour ago. It has made it clear that no request was made by the High Court for rooms in Ashoka Hotel. The courts went on to say that there's an assumption that we asked for this to benefit ourselves. There is also an assumption that you have done this to appease us. They're talking to the Delhi High Court Government Council. The courts then went on to say we can never ask for a special facility for us. Our confidence in this government is shaken. Now, the timing of this order by the Delhi government couldn't have been worse because Delhi, of all cities in the country, is facing the worst crisis both in terms of beds and shortage of other necessities. The common public in the national capital is finding it hard to find basic health facilities. Most people who are contracting COVID are not even finding a bed. Citizens are dying due to shortage of beds and oxygen in the national capital, as has been stated by the Delhi government itself. The special facility that they were trying to set up for the judges amounted to preferential treatment for a particular class, in this case the judges. No such allotment has been done by the Delhi government for any other class or frontline workers in the national capital, including doctors who are really fighting this on the front foot and they are really at most risk as we speak. So there was a clear violation of equality, of right to equality as far as the Delhi government's order is concerned. And here are the big questions that we're asking. Why was no such facility ordered by the Delhi government for any other frontline workers class? Why not for doctors and nurses themselves who are dying without beds allegedly in the national capital? Why requisition an exclusive facility when there is a shortage of beds? And if it was so easy to ramp up these facilities, then why not do it for everybody else? How is it that the Delhi government has failed to ramp up facilities that they're still trying to do in the national capital more than a week after the crisis first started? And can any preferential treatment of any kind be justified? What exactly is it that the Delhi government was trying to pull up here now that we know that the court actually did not ask for this facility? So whose request, at whose behest were they actually asking? So the big question today, even as the Aam Aadmi is exposed to the virus on the streets, it is on the streets to get basic health facilities. Delhi government was planning exclusive VVIP facility for judges. How can they justify that? Let's go across to our guests who are joining us on the show. Charu Pragya of the BJP, Professor D.K. Giri, political analyst, Dr. Arun Gupta, Delhi Medical Council President, and Yashorvardhan Azad, former IPS officer. I have to say at the very beginning that an Aam Aadmi Party representative was set to join this show, but they have pulled out at the very last minute. I wonder why. But I go across to Professor D.K. Giri. The court itself has been very damning. It went on to say that our faith in you has been shaken. What is it that the Delhi government was trying to do? The court itself is saying, were you trying to appease us? That's the assumption.
Yes, the court is really angry with most functionaries in the governance process here. The court, Madras High Court has said that election commission should be charged with murder. So, you know, we have to take the court's comments seriously, of course, because they are very appalled with what is happening. But let me tell you, this disaster is entirely the responsibility, legally, morally, of the central government. We cannot scapegoat the state governments.
No, let's
And I'll
talk
tell you why
specifics
I'm
today.
saying so. No, no.
Professor
Yes, I'm
D.K.
telling you.
Giri, I don't
Yes.
think you understand how much anger there is. All of everyone's family, extended family, friends, colleagues are dealing with this. They are dealing with the shortage in the national capital, and the Delhi government tried to set up a special facility for judges. Please answer my specific question. Were they trying to appease judges even as the Delhi High Court was hearing matter of shortage in the national capital?
No, no, no. Let me tell you. You are saying I have lost family members in this catastrophe. So
I'm
I
saying
have
all of
suffered
us are
myself.
dealing with
Whatever.
this.
11 members are COVID positive.
I don't
It
think
is
I
not
can
a
hear
Delhi
this.
government. They're not appeasing the judges. I think how it come about. You know, there was
Oh, really?
a lot of reaction.
Really, Mr.
There's a lot
Singh,
of
we cannot?
reaction. There is no
If
evidence
they are
of
looking out for people
their
who are
doing it. It
who
was
should
done.
be looking out
Osoka
for?
Hotel is run by the Ministry of Tourism,
Oh,
Government of
please.
India. How
Shivani,
Delhi
please
government can do it? You are really shooting in the dark. This is not legal. Who runs Osoka Hotel?
Shivani,
Tell me.
let me speak.
I'm asking you, who runs Osoka Hotel?
So that's what
It
I'm
is
trying
not
to
run by
ask.
Delhi
What is the
government.
Delhi? This is the
Yes.
Delhi government order. How
No,
quickly they
Shivani,
passed an
Shivani,
order
we
to
know
set up
each
a
other very
special
well.
facility in a
Shivani,
five-star?
we know each other
And at
very
whose
well.
behest were they doing? One second.
That is
I
what
want to
I'm
go
saying.
across to
Okay,
Charu
listen to
Pragya
the
also.
government.
Now the
No,
bigger
listen
question
to me
is.
first.
Now the
Shivani,
bigger
listen to
question
me.
is. One second.
Also,
DK Giri, I will come back to you. You must not talk over me, please. No, I'm going across to Charu right now. You did not answer my question. I asked you a straight question twice. I am not here for dilly-dallying today. Nobody is in this mood today. I'm sorry to say. Charu Pragya, what is it that the Delhi government was trying to pull today? Because the court is saying that we did not ask for this. So if they were responding to requests by someone, how is it that the citizens' requests were not being fulfilled?
The truth is, the judges would never ask for something so arbitrary and something so unfair. If Delhi government really wanted to look out for the welfare of someone, they should have looked out for the welfare of doctors first. Are they even aware that more than 30,000 of our healthcare workers are incapacitated today because they are themselves battling COVID? They are not able to come to work. Hospitals are functioning at 60% capacity. And the next crisis Delhi is going to face is that even if somehow you manage to get an admission into a hospital, there will be no one there to look after you. And that is staring Delhi in the face. The oxygen crisis is another very, very big problem. The court also recognized this today. So if an oxygen supplier has sufficient oxygen and yet it is not reaching hospitals, where is the problem? Where is the link broken? The link is broken because Arvind Kejriwal Sarkar is choking Delhi. The link is broken because they are helping the black marketeers, whether it is for drugs, whether it is for injections, whether it is for oxygen. And who is suffering at the end of the day? It is Delhiites. And Shivani, I'm going to take an extra moment to say this. I am very disappointed an Aam Aadmi Party spokesperson did not join us on this debate because they have disappeared off the scene altogether. You check any platform, they have listed out a whole long nodal officers list you can get in touch with supposedly to find help or bed in Delhi. Not one of those numbers have been answered in the last 10 days. Not one, not in 10 days. How appalling is that? And now they just want to increase the paperwork. Tell me something. If somebody is struggling with COVID, they do not have access to a hospital bed right now, and we all know how bad that situation is. You are aware of it yourself. 70% of Delhi COVID patients are sitting at home, and all they are asking for is access to oxygen. Kejriwalji has ensured that because he wants to help his friends, he wants to help the black market scene, these 70% citizens of Delhi are going to go without basic health care. And
okay, I'm going to come to some other aspects in just a bit, but frankly, what has transpired in court today has shocked everyone. Nobody wants to do blame game right now. We all want to support any government in the national capital or anywhere else in doing their job properly. But this is too much. I want to go across to the doctor joining us on the panel. You had, come out in open and said, why no such facility for doctors? I am wondering, doctor, If it was so easy to requisition these hotels, if it was so easy to ask a hospital to, set up a 100-bed facility exclusively for someone, if it was so easy to transfer the staff that is already so stretched and manage a 100-bed facility, why was it not done for doctors like you?
Is it to me?
Yes.
Yeah, I think first of all, as a
Dr.
citizen, I
Arun.
would say yes, yes. First of all, as a citizen, I would like to say that every citizen has equal right as far as the health is concerned. That is enshrined in our constitution. Since yesterday, I'm getting so many calls from my doctor colleagues. Probably, as doctors are the frontline soldiers in this battle, and they are also struggling to get beds for themselves and their families. I know the scale of the problem is very, very unprecedented. It's very huge, and we are there to support the government, and we are supporting the government. And I don't blame the government the way they're handling it. But once they get this kind of news that some section are getting preferential treatment and preferential the privileges, so they get a bit disappointed. They called me, a lot of them. So we are struggling for the beds for ourselves, our families also, and we are not complaining because we understand there is a problem, and we are there to help the government. And in the same context, I requested the government, because if all the doctors are getting sick, then where will you find a soldier to fight this battle? So I rather, though it's not good for me to talk about some preferential treatment for the doctors, but I would say because they are the frontline soldiers and you need to protect them also. So please do create some kind of facilities, because doctors are also running here and there for beds. So this is my just simple, humble request. We need to save our doctors so that they keep on fighting and they're not scared, or they're not disappointed also.
No, Dr. Arun, you should not at all feel wrong in asking for this. At the end of the day, the healthcare workers are really at the front line. Of course, there are other frontline workers as well, and nobody wants to, deny anybody treatment. But yes, doctors, the nursing staff, those who are working in hospitals, the healthcare workers, if they obviously get, they are able to discharge their duties, then obviously we have nowhere to look to. And that is why it is absolutely fine to ask for, a special facility for doctors. I am not getting the answers as to why, if it was possible to do this, then why are we still struggling for beds in the national capital?
I think, as far as I know, I think the problem is not of bed. The problem is of the oxygen right now. We are enough bed, but we are short of oxygen beds and probably ICUs as well. So actually, every day I get dozens of calls for people, helpless people, but still we are managing to get some beds. I think situation is, I would say, improving gradually. But I think as per constitution, every citizen should have equal right, whether you are a poor person, you are privileged or not privileged. Everybody should have equal right to get the access to these health facilities. That's what we as doctors, we want.
Absolutely. Let me bring in Mr. Azad also. Initially, there was a lot of anger against the judiciary because it was being projected that this was actually asked for or requested by the judiciary, and which government would want to decline the judiciary. What has now come to light is even more damning. Would you agree, Mr. Azad?
I'm absolutely shocked and devastated by this Delhi government order, and I'm happy that the judiciary has come down very heavily on it. It goes against the very grain of our democratic character. It goes against the constitution, goes against everything. And I totally agree with you, Shivani, when you say that why can't preferential treatment should be given, and it should be given to our frontline health workers like the doctors, nurses, even policemen, even all those people who are on the streets trying to manage COVID at the national level. Point number 2 is very simple to say that all these people who are in the hierarchy, they are already getting treatment in AIMS. They are already getting treatment in Safdarjung. It's the other people who are suffering, and the frontline workers and their families are suffering the most. We are a class and a caste-conscious society. I realized that in the previous surge, what had happened was that the doctors are allotted some place for rest and all that, and there the nurses were told that you don't belong to that category, so you can't rest in this room and you'll get some other facility. That's really criminal. And if at all a facility like Ashoka Hotel should be reserved, it should be reserved for nurses, frontline workers, and the doctors. That's number 1. Number 2, Shivani, the point which I want to bring here is that it is wrong to make it a political debate saying that this is AAP and this is BJP and this. Look at the preparation by the every state government. As the doctor clearly said, it is the lack of oxygen. You know, the WHO had said that the cornerstone of anti-COVID therapy is going to be the oxygen supply. And there are 3 states like Kerala, Odisha, Chhattisgarh did well. And they are supplying oxygen to the neighboring states. There is a young collector in Nandulbar in Maharashtra who enhanced and ramped up the oxygen capacity. And today the district is supplying oxygen to a neighboring district. So what has happened today? To hide your own failures, you are trying to do this preferential treatment to either please the judiciary or please some other authorities. Another point, Shivani, why didn't the CEOs of important hospitals ensure that the oxygen plant is attached to their hospital, which is a mandatory requirement? Today, the government under the PM Care Fund is trying to give oxygen plants to almost all the districts, 550 districts, and we should come up by end of April or a little later. This could have been planned earlier also. So what I'm saying is, unfortunately...
No, I take your point. In fact, the point that continues to be is that, you know, individual hotels, airlines, etc. have been doing this work where they are giving, for example, free travel, or they opened up their rooms to doctors and nurses every time this crisis is happening. But governments have greater responsibility. On the issue of oxygen, I want to go back across to DK Giri. DK Giri, how much defense are you going to put up of what has been a government that has been found caught as far as shortage is concerned? Now, this, I'm not saying Aam Aadmi Party government is the only government in the country that has been found wanting. We've asked questions of everyone. But look at what has happened in the High Court today. The government, the court has repeatedly tried to tell the government that, you know, you are not doing the management that the way it needs to be done. Hospitals are saying so, oxygen suppliers are saying so, and then on top of that, you know, you project that if you give an ad for tankers, it is sufficient. If you open a facility for judges, then, you know, we'll be okay. Remember, this is happening even as the Delhi High Court was hearing this matter. How are we to take it? Was it not conflict of interest?
Shivani, I request you to give me the time to speak, because you are saying why Aam Aadmi Party does not join. They do not join because you do not run a balanced debate. You see, Shivani, you and me know each other.
No, that's
years.
not true at all. Sorry, you are not a representative of theirs. Even they, I'm sorry, you don't get to talk on this. No, I'm sorry, Dr. Giri, you don't get to make a judgment on this. You are not part of most of my shows, which Aam Aadmi Party is. So I'm sorry, please refrain yourself. Please speak on the subject. Right. This is why I have to interrupt you. You're not answering my questions.
Okay, well, I mean, the answer has to be to your taste. Let me tell you, you started by saying...
Please answer the question, whatever the answer is.
Yes, I'm telling you, have patience. You started by saying that Aam Aadmi Party booked the hotel for judges for preferential treatment. I told only two explanations. One, Osoka Hotel is owned by Government of India. Why did they give permission? Number one. Number two, the Delhi state is a happy state. I made that point, I think, in your channel yesterday. The Lieutenant Governor is the head of the Delhi state, not Delhi Arvind Kejriwal. You know, according to the latest bill in the parliament. Why do you forget that? You see, so scapegoating Delhi government, hammering Delhi government will not work, because they are doing what they can do. The entire responsibility of this disaster is on the central government. National Disaster Mitigation Act is managed by central government. Invoking that act, they have diluted federalism. They have bypassed the state government. Now, they cannot scapegoat the state governments for failure. The failure is entirely at the door of the central government. No, you cannot invoke federalism here. That is my answer.
The central government has its role to play, and certainly as far as the national capital region is concerned, and those are the areas that have been clearly defined. I'll ask Charu Pragya to respond to you. I'll ask Charu Pragya to respond to you. Whether the state or the center needed to do more. Let me remind you, DK Giri, we have asked the questions of the central government for the last 4 to 5 days running, because oxygen did come under them. But also remember that what has happened as far as the developments are concerned. I will take your query, your points I will take to Charu Pragya. She is better placed to respond to this. I am not going to respond to this. I am just saying that the facts emerging in the court are progressing every day, and the facts also point out to the fact that there is not local level management. Nobody can deny from this. Charu.
The biggest issue is, Shivani, these statements are made arbitrarily and all Aam Aadmi Party people disappear. They disappear like they have disappeared off your debate. Another problem is the central government had been reminding Delhi government repeatedly. 5 letters were sent out warning of the landslide of COVID cases which is going to come. What did the Delhi government do? Nothing.
Charu is not
Another
answering the
problem
question.
that
Who
Kejriwal
runs the Ashoka Hotel? Who runs the
Mr.
Ashoka
Giri,
Hotel?
Mr.
Give me
Giri,
that
I
answer.
think you're very-
You said
No.
Shivani said
Hang
you
on.
answer my question.
Mr. Giri,
Yeah,
I am
who
in no
runs Ashoka
mood to
Hotel?
speak
Yeah.
over you. I am in no mood to speak over you because we are working
One
around
second.
the clock.
It is a debate. It is a debate. You answer my question.
No, 1 second. I can't hear both of you. Please 1 second. Please 1 second.
Shivani took my question to you.
No,
Who
1
runs
second.
Ashoka Hotel?
No, Mr.
The
Giri,
Delhi,
I have-
the Ashoka hospital, the Ashoka hotel order has come from the Delhi government. Clearly, they had the powers. That's why they done it. Had the order come from the central government, I would have asked the central government a question. Just because you ask a question, Dr. Giri, doesn't mean I have to ask the question to Charu Pragya. Please, there is a difference. And I'm running out of patience today of this kind of tactics. Charu, you please respond to the fact that as far as the oxygen crunch is concerned, even the center was found lacking. 1 second, please don't talk over me. The plants were not ready, the oxygen containers or the oxygen capacity, everything had to be augmented only after alarm was raised. And as Mr. Azad pointed out, it was very well known that oxygen would be key and would be precious.
And oxygen had been assigned. But does Mr. Kejriwal need so much of hand-holding in spite of being an administrator previously that he could not even organize for transportation for oxygen for his citizens? That he could not even make sure that oxygen which has come into his city is given to the hospitals? You know, it was such a sad day and we were all crying when we lost lives because a hospital ran out of oxygen. And these kind of incidents are increasing. Mr. Giri is probably not answering distress calls at 3 a.m. with children sobbing because they cannot see their parents not able to breathe. There is no oxygen. Maybe you live a privileged life, Mr. Giri.
Okay, let's not make personal comments. No, Charu, let's not make personal comments. Both of you, please calm down. Let's not make personal comments. No, let's not make personal comments, Charu, of this kind. I have to go back across to our professional, two of our professional guests joining us, the doctor and the former IPS officer. I want to go across to Mr. Azad today. Mr. Azad, the other big question that has been raised is of hoarding of black marketing. There is a sense emerging that not just in Delhi, maybe also in UP and some other states, black marketing and hoarding is not being stopped sufficiently. The court has come down heavily. Today, the court, in fact, has said, it's an observation, you can read only as much as we want in this, that if you can't handle it, the center can take over. That's the kind of remark has been made by the court to the Delhi government. Leave that aside. I want to ask you, if the police or the government really wants, can it not stop hoarding?
You see, Shivani, hoarding is a thing which always comes in crisis. Even in war, for example, even with the shortage of food grains, there was hoarding going on. And therefore, it was expected that in this kind of a surge, if you run the shortage of supplies, hoarding will begin. Now, there is a limit to a capacity and the capability of any organization. Essentially, it is the Drug and Food Authority which should know exactly where is the hoarding exactly taking place, who are the main stockists, etc. The police and EA together, the crime branch has already been told. There are 17 teams. In fact, the DCP had announced, Monica, that they are already on the job. They have already caught about 4 cases, but this is not enough. You know, what is happening is the police is also making green corridors. The police is also helping in oxygen. They are managing traffic. They are helping at cremation ground.
Okay.
So they are absolutely overloaded. So
yes, so they are also overwhelmed. I take your point. Can I give 30 seconds to Dr. Arun, please? Dr. Arun, I just want to end on with a doctor talking about how you keep your faith, you keep your diligence in the face of such a crisis. If you could please, for 20 seconds, just tell us what keeps you going.
One thing I would like to tell you, as a doctor working in the government hospitals as well, we feel so sad that health has never been given proper priority in this country. Even earlier also, before this COVID strategy also, like the tragedy also, the people who are privileged or the poor or unprivileged, they always had a difficult time to access and afford these health services. Now, we never had debates on political front. We never had debates on rallies. We never had enough debates on TV studio also. So this has not come as collapse. It's just probably come as everything is exposed now. The things are really bad. A government has to re-strategize everything. They have to think more about health and more about education also. Unless you make your infrastructure strong and your foundation strong, these things will come again. Every time there's this collapse and we'll start debating.
All right. Well, that's another question that the Aam Aadmi Party could have answered today had they joined, because they claim they have given more in their budget to health and education. So where is it all going? We'll try and ask them these questions. Time has run out. A big thanks to all of you for joining us, and a big thanks to our viewers for watching as well.